We've been talking about this morning, a San Diego man is the first in California to test positive for this new, apparently more contagious strain of the coronavirus. What do we know about it? And does it change how we've been operating? Do we need to protect ourselves differently? We thought we would go straight to an infectious disease expert, Dr. Suman Radhakrishna. She's the director of infection control at Dignity Health California Hospital. And we've spoken to you several times before, Dr. Radhakrishna. We appreciate you jumping on because this new strain is causing a lot of consternation. What is known about this new strain, and do we need to change the way we protect ourselves from it?
First of all, thank you for having me on again. And what do we know about the strain? It is a mutant variety of the existing strain. So all the symptoms that people have with COVID, they would have with this new strain. What is different with this strain is it is more contagious. So a single person who's infected is more likely to infect more people than the older strain did. So that's number one. Number two, when somebody gets infected, the amount of illness or the severity of illness depends on their underlying medical issues. So it doesn't make somebody necessarily more sicker than what they would have been if they got the old strain. Of course, you don't want either strain, but that's what we know so far. And the last one is the vaccine still works.
Okay, because that was my next question, if this was going to throw the entire vaccine program into chaos, but it sounds as though it will not, that the vaccines, the Moderna and the Pfizer will still be effective.
Yes. The basis for vaccinating people is preventing disease. If they do get the disease, it's going to be much milder, and they're less likely to transmit to other individuals. So all those requirements are still being met, even with this new strain.
But because of how contagious it is, do we have to change the way we operate? We've been given guidance that 15 minutes of exposure over a 24-hour period is the point that the transmission rate greatly increases. Does this change that?
We don't know that yet.
Okay.
So, keep it below 15 minutes as much as possible. Get on Zoom calls like the way you and I are doing if we absolutely have to interact with each other, and wear the mask. And for heaven's sake, wear it above the nose and cover the mouth, not below the nose or below the chin.
Yeah, the below the nose one always gets me. Now, as distressing as this may hear to hear of this new strain, this is what viruses do, right? They mutate.
Yes, they do. Every time they replicate, there are changes that happen. And so the new strain is similar to the old strain, but not necessarily always the same. And that is part of the evolution of the virus. Some mutations work for us in the sense that it becomes less virulent and less contagious, and then it goes away, which I hope it'll happen very soon. And some mutations make it worse. And in this one, it makes it more contagious, but not necessarily worse. But if a lot of people are infected, then we are still going to see the problem in the hospitals. We're still going to see a large number of people dying because there are individuals with asthma, diabetes, hypertension in the community. So we have to be careful and avoid congregating as much as possible.
Right, which is, of course, the bottom line of what you want to say to people going into the holiday weekend with the new year. Is it at all concerning that this young man or this person in San Diego, no history of travel, contracted this strain, or the person in Colorado, also no history of travel, contracted this new strain, or is that essentially how it operates?
Well, it's not surprising because remember, you can travel from one half of the globe to the other half within a day. And if somebody's asymptomatic, they can carry it along with them, not that anyone wants to do it intentionally, and then spread it around. So that person who's infected from whom we isolated the virus from may not have traveled, but somebody he got in contact with, might have traveled.
Yeah. All right. So finally, you're urging people to stay home and to stay safe. Are even small gatherings advisable, given what we know about this new strain?
Yes, and my recommendation for New Year resolution: get vaccinated. Let's get rid of COVID.
I like that. You know what? Happy New Year to you, Dr. Radhakrishna. And I hope that at some point you and I can actually sit across from each other at a table in the studio and have a conversation in person. That's my hope for 2021 for you.
I hope so too, and Happy New Year to all your listeners and to you.
You as well, Dr. Radhakrishna. Thank you so much. We really appreciate it. Again, an infectious disease expert, getting some of the answers straight from her is super important to do.